In our community, we do 3 different operations, commonly that being gastric bypass surgery, sleeve gastrectomy, and adjustable gastric banding procedures. The gastric banding procedures are restrictive operations. It causes a restriction in the amount of food that a person eats, and it controls their appetite.
The procedure essentially involves placing a simple inflatable balloon around the top of the stomach. It takes less than an hour. It's an outpatient procedure. The complication rate is very, very low with regards to the procedure, and the weight loss is very, very good.
The sleeve gastrectomy is an operation where a portion of the stomach is removed, making it more slender, more tube-like shaped, and there is a significant decrease in appetite right away with that operation, which makes it very effective.
Again, it's done laparoscopically, which means minimally invasively through small little incisions. Usually it's an overnight stay in the hospital, and most people are home the next day.
And then gastric bypass surgery is both a restrictive operation and a malabsorptive operation. That is to say that not only do you eat less, but you also don't absorb quite all of the nutrition from what you do eat.
It involves actually disconnecting the stomach from the intestines and making a small little pouch, and your food enters that small little pouch, bypasses a part of your intestines, and then passes through the rest of the way in a normal manner.
So weight loss is the most dramatic with gastric bypass, the next with sleeve gastrectomy, and the next with banding procedures. All are effective, but at different rates. The risk of the surgery itself is the same as the risk for any intestinal operation being done on a morbidly obese patient. So I put it in the same category as a gallbladder operation or a woman with a hysterectomy or a colon operation. It's not an inconsequential risk, but it's certainly an acceptable one.
As a nurse, I know that there are risks associated with any treatment in any procedure in any disease state. I could see my health beginning to deteriorate, and the risk of that scared me way more than the risk of a surgical procedure.
Balancing the risk of operation now versus the risk of doing nothing and carrying your diseases forward is what a patient must do.